So good morning, everyone. Thank you for being here. Warm welcome to our colleagues and to all esteemed attendees. We're very happy to start the CND week with you. My name is Tatiana Sleiman. I'm the Executive Director of SCOON, which is a harm reduction center based in Lebanon. I'll be moderating today's session, which focuses on addressing the human rights challenges related to drug use in humanitarian and other crisis settings. This event is organized in collaboration with the Office of the High Commissioner on Human Rights and the International Drug Policy Consortium. It's also part of the program of the CND side events organized by the OHCHR, building on its latest report on human rights and drug policy. Whether from our direct field observations in Lebanon, a country that's been going through multiple crises since 2019, the different reports and assessments that have come out from various countries who have witnessed and experienced humanitarian emergencies, and then more recently, through the latest World Drug Report, which particularly had a chapter focusing on drug use in humanitarian settings, the constant trend that we see is an increase in substance use in humanitarian settings that is paralleled with a shrinking space of responses and adapted services. Our focus today is on the impact of these humanitarian crises on people who use drugs, as well as the challenges and gaps in the response. We want to address with our esteemed panelists how we could potentially emphasize the urgent need for integration of harm reduction services into programming and response in humanitarian settings, as well as the need to reform drug policies so that we are able to effectively achieve our goal of, in fact, leaving no one behind. As we speak of humanitarian crises, I would like to take a moment to send a message of solidarity to the people of Lebanon and the people of Gaza and the rest of occupied Palestine who continue to endure unimaginable human rights violations on a daily basis. I would also like to express my gratitude to our event co-sponsors, as well as the OHCHR and the French Development Agency who supported our attendance and organization of this event. A special thank you to the IDPC team for the amazing support throughout the preparation for this event, as well as to our panelists for their time and engagement. Last but not least, I want to thank my colleague, Michelle Wazdan, who you can see right there from SCOON, for her amazing efforts in organizing the logistics of this event, and who will also be helping us today by keeping track of time. So I will ask our dear panelists to keep an eye on her. She will help you keep track of time. Without further ado, I will now give the floor to Zaved Mahmoud, Human Rights Officer at the OHCHR, for his opening remarks. Zaved, the floor is yours.
Thank you very much, Tatiana. And first, good morning to everyone. First of all, I also like to thank to all organizers. You can see on the banner, there's a large number of entities, member state, and also civil society organization supporting this event. It shows that the importance of these issues, the humanitarian setting, drug use in humanitarian setting. But before I enter to that discussion, I would like to mention that from where we are coming and why we are organizing this event. OHCHR has published a report last year on key human rights challenges with regard to drug policy or world drug problem. Report was based on the contribution by the member states as well as civil society organization. Quality contribution yielded to quality report. And in this report, we have identified 7 key challenges. Already mentioned one challenge is that is humanitarian setting, drug use in humanitarian setting, but others are unequal access to treatment and harm reduction, the war on drug and associated human rights violation, prison overcrowding with the drug offenses, use of the death penalty for drug crimes, disproportionate impact on certain groups, particularly youth, children, women, indigenous people, and people of African descent, and the right to healthy and sustainable environment. The key objective that we are in this side event, we are organizing 7 separate side events to look at all these issues in depth. The key objective of this side event to look at our findings, also the recommendation, associate recommendation, and how to discuss the practical solution and how we can support the member state to implement those recommendations. Already some innovative initiative has been taken by the member state to promote the report or to implement the report's recommendation. For example, I would like to mention Colombia National Drug Policy, which was issued in September last year, informed by our report recommendation. In Czech Republic, government and national drug coordinator organized a national event to launch the report and report findings. Also, European Union invited us to brief the European Union delegation on the report findings. In CND, African delegation organized the event on the report and report briefing. We provided briefing on the report. We encourage member states, civil society, and other UN partners to promote the report and discuss the report recommendation. And this is one of the events we would like to enter to discussion now, that I'm sure that our panelists will reflect on our reports and findings and what need to be done to address these challenges. And it is really critical, the drug use in humanitarian setting and associated human rights challenges to discuss further. And we know that few other side event will be happening around the same issues. So maybe we can discuss and move forward on this particular issue. Thank you very much.
Thank you so much, David, and thank you for the incredible report, the work on the report. We're very grateful for it.
Summary of the report is available here. If you would like, it's very colorful summary. You can take it from here. Thank you.
Thank you, and thank you for the space to have this very timely discussion. Okay. So now I'm very happy to introduce our first panelist, Hanna Dovba, from the Executive Director of the Eurasian Harm Reduction Association. Hanna will be taking us through the Ukrainian context, mainly focusing on what has been the impact on people who use drugs, the impact on access to services for people who use drugs during the war, and other harm reduction services, the links to repressive drug policies, but also what were the gaps and challenges in the response and some of the successful models that have worked to ensure access to services. Hanna?
I'm so happy to be with you here, and I need to first start with the solidarity with people in Ukraine who are every day dying because of Russian missile attacks and Russian aggression against the country. And it's really horrible in the middle of Europe to have this war. And actually, as any war, it's bring much more vulnerability to all the society, but to marginalized group and to people who use drugs, to people living with HIV, to sex workers, LGBT population, it's bring much more problems and stigma, because we all know that society is not ready to accept this population. So it's one of the challenges in the any curfew, in the any crisis, which also happened in the moment when everybody running from the attacks, everybody running from occupation. But in our case, with the Russian Federation occupying part of the Ukrainian territory, important part is that Ukrainian drug policy and Russian drug policy are very, very different, specifically in access and attitude to opioid agonist treatment and harm reduction. So all occupied territories, people who are living there and using drugs, they are on the threat of interruption of opioid, not on the threat, but the opioid agonist treatment interrupted almost immediately. Only some heroic doctors were providing opioid substitution treatment, for example, in Kherson area till the summer, from February to summer. But that's just exceptions. The rule is that on Russian territories, occupied by Russia territories, the harm reduction is not possible, and even more stigmatizing and more crimes conducted against the people who use drugs. And we have some cases, but that's also need to be documented properly, and we will need to have time and secure safety of people to document these violations of the human rights. Of course, all people and people who use drugs and their families lacking basic resources, places to stay, food, and important part is the trauma and gender-based violence. So that's vulnerabilities which occurs with the war. And speaking about the challenges, I need to say that Ukrainian state, Ukrainian Center for Public Health was very flexible and very open to the challenges, and they made important decisions on take-home opioid substitution treatment for 30 days, for example. They make the flexible services in the places where people were moving to in the western part of Ukraine. They made all possible together with the international partners, and we are thankful to UN system, to Global Fund to fight HIV, AIDS and malaria for the emergent procurement of RT drugs and opioid substitution treatment drugs to feed this need in the country. But in the same time, European countries, and we are, again, I need to thank all the European countries for having our refugees and lower the barriers to opioid substitution treatment, for example. But these barriers are still very high, and the challenges with access to opioid substitution treatment, to harm reduction in the neighboring countries is one of the important challenges. So what harm reduction look like in the emerging settings? It is shelter. And you could imagine the harm reduction service delivering the needles exchange age, but this organization needs to transform to the shelter in a couple of hours. And we know examples from Poltava region where the harm reduction organization Svetlana Dia opened 5 shelters in a couple of hours because people from Kharkiv region were running to them. And it's thousands of people with their families and kids and mothers and everybody. So you need to feed them, you need to give the food, you need to give the floor to live, to accommodate. And it's not obviously okay to put people who use drugs, they are not very easy to be accommodated in the general shelters. That's why LGBT community organized shelters for them, and people who use drugs also needed to have specific facilities. You need to bring clothes, and what also we need to do, and that was the role of regional organizations, to bring information about available services everywhere where people are running. So they are in stress, they need to know where to find health facilities, where to find food, where to find the basic humanitarian support. And that was important. In the second day of invasion, we had the full European system, Europe and neighbor, all the countries people running to the system where to find, from psychological support to the food, to documents, to everything. So that was important sign of solidarity of the whole European harm reductionists, not only with the resources, with money, but also with open hands to support those who are running from the war. So that's actually, for me, an important part in this session is to be, it's hard to be prepared to the war. It's really almost impossible. But that, for me, the key answer, what we need to do, is to be prepared to be flexible, to open the facilities, to not to be stick to the job description, and to not to be stick to the very strong protocols developed in the peacetime. So this flexibility, for me, the answer, and it's flexibility of harm reductionists, it's flexibility of health facilities, and it's openness of the state authorities to respond to the pain. Thank you.
Thank you so much, Hannah, for these amazing reflections. And from that point, we will move to Eli Araj, who is the Executive Director of the Middle East and North Africa Harm Reduction Association. Eli, from the experience in the MENA region, and after hearing what Hannah had to say on the Ukrainian experience, what parallels can we draw from the context of crisis, even in 2 different parts of the world? What has been the impact on people who use drugs in the region, particularly for MENAHRA, who has been focused on emergency preparedness in the COVID era? Also, with the focus on Lebanon, what were the challenges in the response? What could have been done better to facilitate access? please give us your overview from your experience. Thank you.
Good morning. Thank you, Tatiana. Thank you, Schoon, and all the co-sponsors. I'm happy to be here with you. I was told I have 5 minutes to talk about all of this, but yes, despite all the struggles that we are going through in the region, and all the difficulties, the economic crisis, wars, we cannot but thinking when talking about human rights, we cannot but thinking of people who use drugs, people living with HIV and other key populations' right to access to health services, especially in the situation where, for example, the COVID or Beirut blast in 2020 has affected specifically these groups. In MENAHRA, as Tatiana mentioned, we developed emergency preparedness plan during a pandemic or other disaster situations in 6 countries. And we found that in the countries, they have their own national emergency preparedness plan, but none of them has mentioned the specific needs of these groups or specific populations as well. So this is how we saw that there is a need to include these plans in the national plans at the first thing. The second thing is that when we look at the current situation of war in Gaza and South Lebanon, the refugees, in addition to the other countries' refugees from Syria, for example, that flooded Lebanon, around the third of the population are being from the refugees communities. The government needs some support, and the civil society organizations as well, because we cannot work alone. In Lebanon, we have the economic crisis near to a bankrupt of the country, and 2 years ago we were informed that there is a shortage of OAT. You know, when there is a person having his treatment, chronic treatment, we cannot stop it. So here comes the role of the civil society, who have a coalition of harm reduction organizations led by Schoon and supported by MENAHRA. We managed to fill in the gap by launching an international appeal and having some drugs to the Ministry of Health in Lebanon. On another situation, I can say that there are some improvement in the region. There is the presidential initiative to eradicate hepatitis in Egypt. There are some support from MENAHRA to these countries, Lebanon, Syria, Iraq. Lately, they have a big problem of stimulants. So in all of this, we cannot continue to support if we are not supported. Let me tell you that the UNAIDS regional office has shut down in the region, in MENA. And this is a big problem, because the presence of the UNAIDS in the region was a big support to the civil society and to improve and implement national strategies in the countries. Now we are somehow struggling with the situation. At the end of this year, there is a MENA grant for civil society from the Global Fund will be ending, and we don't know if we will have a new cycle of funding. So resources are being very scarce, and the needs are being very, very high. So what to learn from this? I think first, harm reduction is about low threshold centers, about low threshold services. So this is why I think we need to include harm reduction services in the primary healthcare centers. Why not? Second, to include the emergency preparedness plan that is mentioning the people who use drugs in the national emergency preparedness plan, ensure the sustainability of the OST, and somehow the UN and international donors to continue supporting the countries, especially the countries that are in crisis. Thank you.
Thank you so much, Eli. I would just like to take a quick moment to also acknowledge the presence of our online attendees on this hybrid event. I hear the virtual room is as full as this room. So thank you all for being here. Thank you so much, Eli. We see a lot of similar trends and challenges, no matter the country, no matter the actual crisis settings. We see a lot of similarities, and we also see a lot of similar recommendations of what could be done to ensure a more timely and effective response. And on that note, I'm very happy that we have here with us Annette Vester from the WHO, from the WHO office, who will basically be taking us through the mechanisms that already exist for the response, but also how and what are the essential things that need to take place so that the response happens in a faster way, in a more prompt way, because in emergencies, time is of the essence. So how can we ensure, whether through more interagency coordination or maybe more specific guidelines related to drug use in humanitarian settings and harm reduction, how can we ensure a more timely and effective response to be better prepared for future crises? Thank you so much.
Thank you very much, Chair Tatiana, and thank you OHCHR for this amazing report and these 7 side events. It's really incredible that this UN organization has been able to achieve this. So I think a lot of things I wanted to say have been said, and maybe just to start with the fact that the World Health Organization, where I work, is responsible for providing guidelines, normative guidance on how to respond to public health crises or issues. And for us, this is not only around harm reduction, but it's also around access to controlled medicines, for palliative care, for pain control, etc. So I want to highlight that point as well. Harm reduction, recently, 2 years ago, we issued new guidelines where we defined harm reduction more simple than the 2007 and 2012 technical tools that were adopted also here at CND. Basically, the provision of sterile injecting equipment through needle and syringe programs, opioid agonist maintenance therapy for the treatment of opioid dependence. And I want to highlight that this is a first-line treatment for opioid dependence and has an added benefit of reducing transmission of bloodborne viruses such as viral hepatitis C and HIV. It's been very much pushed through the infectious disease lens, but it really is a first-line treatment for opioid dependence. And the third component of harm reduction is the community distribution of naloxone to prevent or to manage opioid overdose. And that this naloxone is not just available in hospitals or in ambulances, but with first responders. So people could be present when overdose occur. So in order to, I think one of the important parts of this new guidance from 2022 is that we're very much aware that it's easy to say what is most effective and to say these are the harm reduction services or other important services to implement. But as long as structural barriers continue, then these services will be difficult to access for people who tend to be criminalized and stigmatized. So in addition to just providing this health package, for the first time, WHO also highlighted the importance of addressing structural barriers such as criminalization and recommend countries to review and revise punitive laws and to work towards decriminalization of use and possession for personal use. Another area to look at which are related to criminalization, of course, are stigma and discrimination, particularly in the health sector, but also violence, and to support the empowerment of communities. So this is the background. And this goes to say, and you may have heard our Director General on Thursday morning also saying that we urge CND to when discussing drug policy and drug policy reform to balance a greater focus on public health versus criminal justice. So this is the background. During COVID, I think this has helped us define what should go in what should be prioritized, which services should be prioritized in settings of humanitarian or other type of crises. And we managed to have harm reduction and access to essential controlled medicines as defined as essential services. So OAT, NSP, and naloxone are essential services. I think, having said this, it's important that harm reduction in settings of humanitarian crisis is already available, because if it's not there, I wouldn't know how to scale up and assure continuation or start something in such a difficult environment. So we have the example, of course, that Ghana described about Ukraine, where there was already a very good harm reduction program implemented, and we all got together to assure continuation and access to methadone for prescribing. But it is important to also realize that. Now, I think I'm only coming to your question here, is to, in settings, I think Ukraine was a good example. At the first few months, we had weekly calls with everybody. And because when there's a humanitarian crisis, everybody wants to come and help out. And sometimes this just is very difficult to manage on the ground. So it is really important that, I think, at the UN level, but also at implementation and humanitarian agencies, to really organize and decide who is responsible for what and who will take the lead on what. And that, of course, with the background of the urgency that you mentioned. And in order to, I don't think we can give a blueprint for how to do this. It depends who is on the ground, who already has a country office, for example. Is it UNDP or is it WHO that can take the lead in this organization? But the urgency component, of course, is critical here. And I just want to quote a colleague from Ukraine on the humanitarian response in Ukraine, that it has to be a mobile response, a digital one, an agile one, a relevant one, and an innovative one. And just to conclude, the innovative one, for example, in Ukraine, the adoption of long-acting buprenorphine, where people don't have to come every day to take their methadone, but they can come once a month to get an injection, could be hugely relevant. And we are supporting that with research to find out if it works as it is supposed to work. Thank you.
Thank you so much, Annette. I mean, to just summarize, what we hear from you is access to controlled medication, effective interagency coordination, but also a foundational baseline at the state level that ensures that we can at least reduce the barriers when emergency strikes for people who use drugs. So a lot of things need to happen in parallel. And thank you so much for your reflections on this issue. Very, very timely, important, and on point. Thank you so much. You started by speaking on access to controlled medication, and you ended with this as well. And this gives us a wonderful bridge to our next panelist, Nelle van Tomme, who is the drug policy officer from the Federal Ministry of Health in Belgium. Given Belgium's role in advocating for access to controlled medicines, and from what we've heard today, one of the main challenges faced in humanitarian settings is sometimes the risk of interruption of access to controlled medicines, particularly OAT for people who use drugs. We've seen, for example, in the context of Lebanon, interruption that has resulted in people having to suddenly reduce their dosages, many going through extensive withdrawals, many having to go into hospitals. What can we do as a collective to ensure that in situations of crisis, and beyond, potentially. Access to controlled medication is facilitated, it's not interrupted. How can we make sure that all of these different regulations on export and import and procurement and authorizations, at least in context of emergencies, can be relaxed or revised to ensure that people have access to their right to health? Thank you so much.
Yes, thank you very much. Yes, well, let me start with referring to the report of the OHCHR. There it's clearly mentioned that having access to and availability of internationally controlled substances for palliative care, cancer treatment, surgical care, anesthesia, drug dependency, mental health disorders, neurological conditions is at the core, is one of the core minimum obligations of our right to health. And as you said, Belgium is advocating already for many years for more awareness and more actions. And just to recall the conventions, because they are the basis of the drug policies. In the conventions, it's clearly mentioned that narcotic drugs is indispensable for the relief of pain and suffering. And in the conventions of psychotropic substances, it is clearly recognized that the use of these psychotropic substances for medical and scientific purposes is indispensable. And we all know that at a global scale, these commitments and these obligations have not been met. The numbers are known and staggering, and it staggers me every time, is that in low and middle income countries, 85% of the world population consume only 11% of global quantity of internationally controlled opioids available for medical use. And when we look at the numbers of terminal cancer patients and HIV patients worldwide, who suffer from each year from the lack of this adequate treatment of moderate and severe pain, it's staggering. So that is why Belgium is focusing on this topic. And we all know that the reasons why these imbalance to access and availability to controlled substances, that it is a complex combination of political, economical, social, and technical elements. For instance, to restrict application of the international conventions and regulations may compromise access to opioids. But also governments' policies are often influenced by their concerns about abuse and non-medical use of patients and the fear of diversion and illicit trafficking. Cultural barriers and stigma, along with misconceptions among health professionals, caregivers, and patients about the proper use of these substances can hinder access, and furthermore, the lack of data. So these are like the barriers where governments need to focus, need to be aware of, and need to try to change the situation. But we also know that addressing these issues requires a deep examination of context-specific barriers and enablers, and prioritization of interventions tailored to each individual setting. And these challenges, as you just come to mention, are particularly pronounced in emerging armed conflict settings, humanitarian crisis, chronic conflicts and insecurity, but also in geographically difficult areas. And yet in these situations, the access to morphine and other essential medicines to alleviate serious health-related suffering is even more urgent. What can we do? Well, as Belgium, we are trying to create more awareness, to try to convince governments to at least assess the situation. So last Thursday, Belgium have organized a high-level side event that took the time to review the achievements accomplished so far and to remind of our collective commitment to make a significant progress by 2029. And this CND, we're also introducing a resolution on access to controlled substances together with Côte d'Ivoire and EU and its member states to encourage member states that when they assess, develop and implement policies to improve access to and availability of controlled substances, to also consider the needs of children. Because we have all our common goal to take this responsibility to make sure that no patient is left behind. So some key observations. First of all, as I come to mention, it is necessary that everybody takes his responsibility to ensure this access to controlled substances, and that it extends to emergency and crisis settings where flexible and simplified control medicines are needed, so that procurement is facilitated and the dispensing process is also facilitated in these critical situations. Other things that can be done are, for example, the systematic inclusion of adequate oral and injectable formulations of morphine and other pain-relieving medicines for both adult and pediatric use to aid response packages, but also these essential medicines for surgery, anesthesia, for treatment of drug use disorders, mental health and neurological conditions, and also to improve, of course, the understanding and the expertise of people who are providing these medicines in humanitarian and healthcare providers. So we call up government to establish emergency response mechanism to ensure access to opioid agonists and other essential medicines. And we also want to bring your attention to the critical importance of considering the needs of children, because they are not small adults and they need appropriate dosage formulas that are suitable to their age and development stage. So their needs also need to be considered when establishing emergency response mechanism or humanitarian aid response packages.
Thank you so much for your intervention. And I mean, just to summarize on your closing point is that the issue of repressive policies is not only impacting people who use drugs, but it's also impacting the rights of other people in accessing timely medication. So it is indeed very important to have this conversation on flexibility and facilitating access, particularly in crisis response settings. Thank you so much. Before we go to our closing remarks, and since we have the luxury of time still, we're going to give maybe 10 minutes for Q&A, but right before that, I'm going to very quickly give the floor to Ms. Karen Hechen-Leitner from the OHCHR office and special mandate on the right to health. The floor is yours.
Thank you very much. So I work with the office of the special rapporteur on the right to health. She couldn't be here, but she sends her regards. Thanks again for organizing this timely and important event. As some of you, the special rapporteur will be presenting a report on harm reduction to the Human Rights Council in June this year. She has an anti-colonial, anti-racist, and intersectional approach. And before presenting this report, the Health Mandate has been intensively elaborating on access to treatment, medical care, and harm reduction service for people who use drugs and need such services, as well as access on medicines for all. From a human rights perspective, access to medicines is intrinsically linked with the principles of equality and non-discrimination, transparency, participation, and accountability. And the special rapporteur also asked me to convey that in October this year, she will be presenting another report, this time to the General Assembly in New York. And this report will be focused on harm reduction for sustainable peace and development. And she is considering including also issues related to humanitarian and conflict settings, among others. She also asked me to express that she looks forward to continuing engaging with the different stakeholders present in the room in the preparation of the upcoming report. Thank you.
Thank you so much, and we look forward to the report and to the contributions to the report. Thank you so much, Karen. So we will now open the floor to Q&A for a few minutes. If anyone has any questions to our panelists, please feel free to just raise your hand and maybe just introduce yourself quickly and then go for it. anyone in the room, or should we see if anyone online has any questions? Michelle? No questions. We've been super clear and on point. Go for it. We have one quick intervention from Annette, and then Hannah, and then we will move to Okay,
Yeah.
so go ahead.
Thank you. I just noted it in the chat, but also Ghana mentioned it. When we talk about humanitarian or other crises, not just to think of the country in crisis, but also when people are displaced and flee in the neighboring countries where they go to, that we need these responses as well. So I think it's a really important point to stress. Thank you.
Absolutely. Thank you so much. And on that note, I would also like to highlight that UNHCR are having a side event that's particularly focused on humanitarian crisis and displaced populations, which we'll be following, of course, and see how we can bridge what were our discussions here and the discussions there, because indeed the issue of displacement and the impact on displaced populations, especially when the policies from the country where they are to the country where they go are different, it creates even more barriers. So thank you so much for highlighting that point. Hannah, should we go for it?
I have two issues to add in the complexity of the problem. One is mentioned already on gender-based violence and responding on sexual and reproductive health of people who are running from the war. And Ukraine is documenting a lot of cases of gender-based violence. You all saw the pictures of Bucha and Irpin and all these horrors, but with the people who are marginalized and more vulnerable, like women using drugs or sex workers or LGBT people, that's even more complicated. And having lack of access to abortion, for example, in Poland, it's a big issue for displaced people from Ukraine. And the same with sexual reproductive health rights. And the same with the preventing and addressing gender-based violence in the mental health facilities, in shelters, training for social workers, training for medical cares to cope with this. And the one more complexity I need to add, it's people imprisoned, because in the moment of invasion, people are closed. They couldn't find the food somewhere because they are closed in prison, and they couldn't find any medication. There was a huge shortage on the general medication in prisons, and we need to think about it. And in case of Russia, they deported the prison population, and it's very hard to get them back. So that's important part. Complexity of in prison, that's outcome of criminalization, people sitting for use and possession in prison, and they are much more vulnerable than people in free, even than people who are free to move at least somewhere. Thank you.
Thank you so much, Hannah. Indeed, I mean, as Annette and Hannah have mentioned, the issue is also addressing the exacerbated vulnerabilities and compounded vulnerabilities when you are a person who uses drugs caught in crisis, but also belong to a specific community or a specific group or specific marginalized community. So thank you so much for shedding light on this. We have one question or comment, please go ahead.
Thank you so much. Is it better now? So thank all of you guys for this important debate in this historical time we face. Those horrible
May I ask you
wars.
to introduce yourself? I'm sorry.
Sure. My name is Tessa, and I represent a Brazilian civil society organization called REDUC. And I want to inform that the Brazilian Senate have proposed a modifying to our constitution, to Brazilian constitution, which aims to deepen prohibitionism and criminalize the possession of any amount of drugs. And it's in Senate's agenda tomorrow. And it is an attempt of the Brazilian Senate, which is opposed to our government, to criminalize the possession of any amount of drugs
And this means to keep Brazilian Black and favela population under a particular type of war and apartheid regime that goes on since colonization there, when punishment of the law only affects them, and also imprisonment and enslavement and torture. So I would ask for the table to some comment about that issue. And there's a petition against this, and if any organization or country would like to sign, I have the QR code right here. Thank you so much.
Thank you so much, Saved.
Thank you very much for raising this issue. We had been informed, our Human Rights Office, and we are looking at that how we can communicate the concern to the government with the support of our colleagues on the ground and also in the regional office. Thank you for raising this issue. I'll be in touch with your colleagues as well on that. Thank you.
Absolutely, and we second Zaved in our support. So we've signed the petition. We invite colleagues to sign the petition, and hopefully we will be able to make change happen. Thank you so much for bringing up this issue. I will give the floor also quickly to Eli Araj for a quick comment, and then we will move to Dr. Lasha.
I just realized that there is a group, a community that is missing in this panel. People who are deprived from their liberty, people who are in the prisons. We didn't talk about that, but just to share with you that in Lebanon, due to the inflation and the economic crisis, the internal security forces couldn't afford to pay the medication for the prisoners. There is a group currently of a platform of civil society organizations. We are contributing from our own pocket just to ensure the medicine, lab exams, etc. for the prisoners. People are dying somehow in the prison, not because they are tortured, no, but because we cannot afford to pay their medicines. I think here again, I need to bring your attention to focus more on this group. Thank you.
Thank you, Eli. And now we will close.
Sorry, we have one question online. Do you mind if we?
Sure, go for it.
Thank you. I'm just going to allow the person to unmute themselves.
Good morning, everyone. My name is Emmanuel Olatunji. I work with the Global Fund as the Fund Portfolio Manager for Middle East Response Grant. And I want to applaud and congratulate SCOAN and our partner within the UN and other collaborators on this initiative. Truly so that punitive policies and all other structural barriers have continued to hamper HR initiatives. And for us as the Global Fund, we are continually increasing our investment across countries on HR harm reduction initiatives and collaborations. However, one of the big issues that we often encounter, and even Eliaraj mentioned it, and we are working together, and Eliaraj also flagged the fact that there is the challenge of financing, and this raises the question, how can we mobilize, galvanized government to begin to address those policy issues, especially where there are obvious criminalization, obvious punitive measures in place. We need government to be able to alleviate or sort of make those policies more friendly and enabling in a way that integrated services can be delivered. And that way we are mainstreaming some sustainability of services. And I think I am flagging this because it's one of the bottleneck to effective programming that we are seeing and hearing about from countries that have advanced on their HR initiatives and innovation. So I wanted if any of the panelists has got an experience of how we can do this, but also it's an evolving conversation and evolving innovation around this thematic area. Eli, I hear you a lot about the prisons. We are continually encouraging especially the TB programs to expand access to TB work, expand TB work into the prisons. for screening, diagnosis, and ensuring that treatment is established, especially for TB. And where possible, they do TB, HIV screening as well. So I think from that perspective of the Global Fund side, we are trying to push for that agenda. So I hear you, and I will also take that back to colleagues. Thanks, over.
Thank you so much, Emmanuel, and thank you for following this session. We really appreciate it. Unfortunately, for the sake of time, we're not going to have the time to discuss the points you just raised, but obviously they are well taken, and hopefully we will have other spaces to go more in depth, because indeed, resource allocation is one of the main challenges in having any response or sustaining any response. So without any further delays, I will now give the floor to Dr. Lasha Gogwadze from the International Federation of the Red Cross and Red Crescent Societies for his closing remarks and recommendations, giving us a summary of everything that we've heard today and hopefully opening the path for actionable recommendations. The floor is yours.
Thank you very much. And so I represent the organization that works before, during, and after emergency situations. So I think it's important message to respond to the statements that was made. And so also thanks for organizing this event that is challenging, including my organization, even though it's the topic that we are discussing for a long time, and lesson learned for all of us in the future. So I will try to summarize this. Maybe in the next hours we can refine the wording, etc. Because it was so many new and ideas coming. So basically, definitely, all of the panelists mentioned that, okay, we need to integrate the needs of the people who use drugs, and so in risk communities, at-risk communities within humanitarian response planning, implementation, and funding allocation. Ensure access to control essential medicines. It was also mentioned, namely opiates treatments, as well as pain management and palliative care medication in emergency and crisis settings. Through relaxed control measures, I think that was mentioned from Belgium and others, that facilitate procurement and dispensing process. Ensure interrupted opioid agonist treatment provision in crisis settings through the establishment of emergency response mechanisms that can rapidly address shortage and mitigate the risk associated with unavailability of opioid treatment. Meaningful engage harm reduction civil society organizations, affected communities in emergency and humanitarian response planning and frameworks. Well, here sometimes we can't plan the emergency and humanitarian response. So it's I think that's why it's important to have the ongoing programs before any emergency or crisis, and that really can make the system a bit more resilient to function in the crisis situation. Broaden UN response to drugs and include human rights and humanitarian agencies. So I don't know. So maybe we can. So where we can include. So basically here, I think maybe you helped me to formulate the question, so that we need to engage in this, in the process, all the humanitarian agencies somehow. So maybe we can make it stronger. Reform drug policy, shifting away from punitive models and adopt drug policies based on health, human rights that recognize and advance the rights of people who use drugs. So I think that's how it is. Maybe the final version can be changed, some wording, some statements might be stronger. So I think the two things I want to underline that was mentioned. So yes, substance use in humanitarian settings is increased according to the World Drug Report. Do we know whether it's increased? Do we knew before? So do we paid enough attention before to this issue? And then you mentioned basically that lack of data, even now. So I think this gap needs to be covered. The second thing, so we mentioned access, lack of access, not only to this, but all health in settings. So how we can link the health, including the harm reduction programs and others, in the context of universal health coverage. So this is the umbrella, global umbrella. So if this is not addressed, So how we can achieve it? Yeah, and also talking about lots of things. The equity needs to be really strong. If we mentioned the issue of the prisons, if we mentioned the issue of the gender inequity, etc. So those maybe these two, three aspects can be included in the recommendation and the final one. And thanks again for inviting. So I could not share our own experience, but for me it was absolutely privilege and pleasure to summarize the wonderful event. Thank you. Important event. Thank you.
Thank you so much, Dr. Gogwadze, for this very good summary. Of course, this event today and those 50 minutes, it's only a conversation starter. The point of being here is for us to be able to shed light on this very important issue and this very timely issue, given the global context of crises. But the idea is to gather, by gathering all of us here, is to take things to the next steps, whether we do it bilaterally, us with you, or you among each other, or us as a collective. The idea is that from this point onward, we start the conversation and we reach actionable recommendations where everyone is involved and everyone has a role to play. Thank you all so much for coming. Thank you for starting the CND week with us. Thank you to our co-sponsors. Thank you to Zaved, to Adria, and the rest of the IDPC team for all your support in the preparations. Thank you for the panelists. You've been incredible, and you've really, your messages were extremely on point. Thank you so much for your engagement also in the preparation. We're very happy to start this week with you, and we hope it's going to be a fruitful one over the next 5 days. And now we can release you to the many other side events and plenaries that you have to go to. We will be sharing the recording of this event and a summary of the recommendation with everyone, in-person attendees and online. I believe we collected the contact information. Thank you so much, and please feel free to reach out to us if you need anything or have any questions. Thank you.